everyone, I am Dr. Kirti Sabnis. I am Infectious Disease Consultant from Fortis Group of Hospitals, Mumbai. So every year, 1st of December is celebrated as World AIDS Day. So in this day, we try to encourage and create awareness about what is actually AIDS. First is very important about its prevention and also treatment and overall quality of life of people who are affected with AIDS or what is called as HIV. So today we will discuss few things which as a common public or as a non-medical public everybody should know. So what is AIDS? So AIDS and HIV are two different things. AIDS is an advanced stage of HIV. Not every patient with HIV has AIDS. It's very important to understand this because there is a lot of stigma, there is a lot of negative impact associated with the word HIV infected people. So actually with a good medicines which are available, good diagnostics which are available, people can live a normal life, a near normal life with HIV when they are on a regular therapy. So we don't need to have any social stigma around them. People with HIV can live a normal life, can have a normal family life, can have kids and can do a natural normal job as any other patients without HIV infections are doing. So it is this day we should definitely increase our own awareness regarding the HIV and AIDS. It's very important that people with HIV gets diagnosed early because as early we start the therapy, better the quality of life is maintained. So this now we will a few minutes we'll discuss about why it is important to get HIV tested for everyone. So many people will say, I don't have any symptoms, I don't have any problem. Why should I get tested for HIV? Because testing for HIV is also associated with a lot of stigma. Why are you getting tested for HIV? Have you done anything? So first we have to make it clear that HIV can be transmitted with three very important routes. First is unprotected sexual intercourse with people who are positive on HIV and without any antiretroviral therapy. So people who are having high viral load, that people who are not on therapy can transmit a disease very easily than the people who are on therapy. Second, it gets transmitted from a mother to child if the mother is not on anti-HIV therapy. And third, now it is very rare, can be transmitted from infected blood products. Fourth, it can be transmitted from infected needle sharing from one person to another, like people who can share while having IV drug abuse. So without this, the transmission of HIV is not possible. So that understanding this is very important because people try to discriminate people with HIV, try to have separate clothes and food and utensils from them. So this is actually not required. The key is early and effective diagnosis. So people who normally HIV testing is recommended for people who have high risk behavior, multiple sexual partners, IV drug abuse. Those people definitely we recommend them to have a testing, or people who have had a history of an unprotected sexual intercourse with an unknown person. So these definitely we recommend for them for testing. We also recommend testing for healthcare individuals who are coming into contact while doing some medical procedure to a patient who is HIV positive. Other than that, I recommend actually to get the HIV test at least once for all females because in pregnancy the testing is anyway mandatory. But if you get tested without any symptoms, and if that is a chance when you can detect early, you can have an effective therapy. So government recommendations or WHO, which is a guideline giving body for HIV/AIDS, recommends, as I said, 4 people to get the 4 listings to get tested. But other than that, I recommend for all females in the reproductive age, all males in the reproductive age, and before getting pregnant as routine screening, everybody should get tested because these are the opportunities where we can diagnose early and give an effective therapy. Many people ask me what are the therapies available. and do people need to spend a lot of money and time to get this treatment done? So first of all, we should know that HIV, till now there is research going on, but till now it is not a curable disease. It is like diabetes. You take medicines, keep it under control, and you can have a normal free life as any other people have. So treatment is available from Government of India. Actually is doing a really wonderful job. They have multiple centers called as NACO centers, or National AIDS Control Authority centers, which give treatment and diagnosis freely. So if anybody wants to get even tested for HIV, they can go to these centers, and testing is done free of cost. So money is not an issue for doing the basic testing for HIV and getting a treatment for HIV. So let us now, our government and also WHO has a slogan to reduce the transmission and completely stopping AIDS by 2030. So if we remain active, if we remain little vigilant, and when you get an information, you can spread to somebody who needs it, that will definitely help in ending spread of HIV by 2030. So let us take this initiative for this year's World AIDS Day, which will be celebrated on 1st of December. Come, let's join me.